Ashley with Amare. So today we're going to talk about injectables. This is like a very broad topic, but we're going to talk about it. So let's start with Botox, fillers, KyBella, PRP. Those are all injectables. Those are done by nurses or injectable professionals who are trained to know where the nerves are on the face, where the planes are, how to inject properly, all those kinds of things. Now, there are some dangers to this, which we're going to talk about. But let's talk about why people get injectables. So something like Botox, something like fillers, those things are mostly for the face to contour, to lighten, highlight, do all these different things. Most of the times it's for shaping, for sculpting, for the jawline, for the cheekbones, for the nose, for the forehead, for these little like lines that people normally have that are like imprinted into the face. That's what injectables are mostly used for. Sometimes Botox can be medically necessary, used for the jaw, TMJ, things like that. It does help. What does Botox do? Well, basically, it's not exactly, but kind of like a neurotoxin. It stops the muscle from working as much. It keeps it more like relaxed. Now, too long with Botox, prolonged, can cause muscle atrophy. What does that mean? It means that the muscle isn't as strong anymore and starts to thin out because you're paralyzing it basically all the time. That's why some people have too much Botox done or too much work done. You can kind of see it in their face. You can see like where like their eyes don't move or their forehead doesn't move or their whole like jaw doesn't move properly because they've gotten Botox. So that's that. PRP, what is PRP? Platelet-rich plasma. Basically, they take your blood out, they clean it, they shuffle it around, they get it rich of all that platelet and plasma stuff, and then re-inject it into you. So, what does that do? It helps with growth, it helps with plumping, it helps with a lot of what it's mostly used for is hair loss. PRP is used for right in the scalp for hair loss so that it can regenerate because it's platelet and plasma rich. So it helps to regenerate a lot of stuff. It has been used in knees and hips and things like that. PRP cannot be used for weight loss. I don't know why this is a new thing, but if you have like stubborn fat and things like that, I don't really suggest PRP. PRP is for regrowth. It's for cellular deficiency. It's for things like that. It's not really for weight loss. So let's just clear that up. The other thing that's a very popular injectable is KyBella, and there are a couple other ones that go along with KyBella, but KyBella is the most popular. So that's usually done to like the jaw, the chin, that area, little areas on the face. KyBella is used to get your body to kind of kill the fat or eat the fat away. So KyBella is used for very little areas. Like I said, the face, the cheeks, the underneath of the chin, maybe even sometimes the neck if you have a little bit of like rolls or neck fat or something. KyBella is used to kind of get rid of, PRP is used to create more, and then Botox is used to get rid of the lines on the skin and get the muscles to relax. So those are the most common. The other thing that's been super new that everyone's talking about is the POD threads, which is basically like a suture with barbed wires or whatever in it. And they put it into the face and they inject it and then they pull. And it pulls the skin and it lifts. The theory behind this is that once that's in there, the suture heals with the skin like this so that you get that lift. They do it for the eyebrow lift, they do it for the face, they do it for the neck, and it's been a very good thing, and it has worked for a lot of people. I haven't looked deep enough into it to know the real side effects, but coming from a health standpoint, we're going to talk about all these things as far as recovery. So that's what they are. Those are like the injectables or the little things. Now, if you guys go for these things, please keep in mind they are minor procedures. These are not like, oh, I'm going to get a whole new face, like, oh, I'm going to totally like lift. There are eyelid lifts, which is where if you have droopy eyelids, they'll put an incision right there and they'll lift the eyelids so the skin is tight. They do it underneath as well. A facelift, the incisions are behind the ears and they pull and they lift so all the skin comes back if it's drooping forward. They do tons of great actual surgeries that last a lot longer. Again, something like Botox needs to be done regularly. POD threads, they haven't really figured that out so much yet, but usually it's like a year, it settles in. With age, things like that, with use, it'll start to droop and you'll probably have to get them done again. Something like KyBella, again, it eats away at the fat or it causes that slimming effect. And there are other things that do that as well, injectables, but you have to keep going to get them done. So if you guys know that this is something where you're like, okay, I really want to fix this, you're better off going for the actual surgery. Now, recovery and downtime for all of these things. For PRP, which causes swelling, by the way. I have dealt with several cases, women especially, who will have Botox and fillers in their face done and do PRP on their scalp, and then the swelling drips down into their face. And if you don't come in to get lymph drainage done, to get us to take that stuff out and get your body to absorb it back and suck it in, your face will look like a balloon and bruised and all kinds of crazy. Now, here's the thing. Fillers. So Botox paralyzes the muscle, right? The lymph vessels are inside the muscle. If those lymph vessels aren't pumping because the muscle is not contracting, you're not getting proper lymph flow. Now, it is on a minor scale, but it can cause puffiness, irritation, swelling, things like that. So that's Botox. Fillers go in and stay in place. They also kind of block that roadway. So when you're talking about a little bit of swelling, not terrible. You're not really going to see anything, right, with Botox and fillers. But when you're doing something like PRP, where it's putting it in there and it has to stick and rejuvenate everything, and you have fillers on top of that blocking the way, or Botox where it's not moving, and you have massive swelling that's now blocked and not moving, and we're trying to rejuvenate the area at the same time, that's a lot. That's a lot on your body and a lot on your face. So I have seen many cases where people come in who've had Botox, fillers, all kinds of stuff done regularly, go to do PRP on their scalp, and then all the swelling drips down into their face, but it's like, it's not really moving. It's just there, and it's stuck, and it's really bad. It looks like you got hit in the face with a baseball bat a couple times. So there is minor bruising and swelling that comes with injectables. That is fine. There are extreme cases, and here's where the risks come in. With injectables, if they hit a nerve, they can do, paralysis or damage. If they hit a vein, you can have extreme swelling and bruising. What do you do at that point? Well, you can wait it out for the 7 to 10 to 14 days, or you can come in and see us immediately, and within 4 days, it'll be completely reversed and gone with lymph drainage. So we deal with these complicated things. Now, again, everybody thinks injectables is like, oh, okay, we're just going to do the injectable, and it's going to be fine, and my face is going to be great, and it's going to be amazing. Well, yeah, but what about the downtime? What about the recovery? What about the healing? PRP, the KyBella stuff, the Botox and fillers. We can get all of that swelling down and get all of that to stick and become a lot more enhanced and a lot better results if you come in to see us and start getting MLD done. Now, of course, we're going to talk to your doctor, your dermatologist, or your injectables professional. We're going to work with them. We're going to ask what's safe. We're going to ask what was done. We're going to be fully involved as we always are. But you don't have to wait that whole time, especially if there's an emergency like that where you do have massive facial swelling where it's super painful and you can't even open your eyes, or they do hit a nerve or a vein on accident and you blow up and have tons of bruising. We can get rid of all of that in like 2 or 3 days. Within your first session, you'll see major changes. But again, these are part of the recovery of it. Yes, even though it's not surgery, injectables still require recovery. Injectables still require a little bit of downtime, the same way that cool sculpting does, the same way that any of the major surgeries do. So that's my little tidbit on that. But let's talk about long-term effects of these things. Again, with Botox, you can have muscle paralysis. With fillers, it's fillers in your face that are stuck there. Your body, yeah, they're going to wear off, but if you're doing that for years and years and years and years and years and years on end, same thing with fillers in the lips. Our lips and our mouth move a lot, and your lips can get swollen. Let's say you get punched in the face. You get a fat lip. How does that swelling come down? The lymph system, by moving it. Let's say you get fillers in your lips and they accidentally mess up or hit a vein or something, and one side is bigger than the other. I've seen that, where half the face is way bigger than the other. That does happen. And we can fix that, and we can get it to drain, and we can get it to be even, and we can actually still save your results in the process. So a lot of people think when these things happen, they go back to the dermatologist or the injectables professional, wherever they went, their nurse, and they're like, well, what do I do? And they're like, well, you just got to heal and wait it out. Well, that's not true. We can help. We can get rid of that. Now, there are, being with the lymph system and something like PRP, there are natural ways to get plump lips, to smooth out the lines, to work on the face, to work on the eyes, to tighten the skin. There are tons of holistic things, right? There's jade rolling, there's infrared light, there's microneedling, there's all these different things. So if you are looking, and I'm going to do a couple more videos on this later in the month, but if you're looking for a natural way to get those looks and generate all of that nice collagen and those white blood cells, all of that is done by the lymph system. So we do offer facials, which are not actual facials, because when we think about facials, we think about poking, prodding, products, all kind of like things, not really just massage, but all kinds of other stuff, extraction, all things that they're doing to your face. But we offer manual lymphatic drainage facials for just the face, the head, and the neck to get all of this to drain out. So with that being said, who would be a good candidate for that? Well, somebody in the emergency situations of the injectables gone wrong, or people who have a little bit of swelling under the eyes. They want their skin to be a little bit more firm, or a little more contour in their face, things like that. There are tons of things you can do, gua sha, like I said, jade rolling, tons of things you can do to help with the muscle tone, to help with the skin. And again, muscle tone, if the muscles are contracting, the lymph system is swallowing everything and processing it out through your body and taking out the swelling. So face massage does help, but when you have a lymphatic facial, where we're directly working on the lymph system, we get these lines to smooth out. Because when you're talking about the labial folds on the face, which are like these lines here, what causes those lines? Well, it's not the line itself, it's the things above and below it. It's the swelling from all of this and all of this and all of this that causes these deep lines, because these are muscles. So if they're swelling around that, you're going to see it, and you're going to see those lines deepen a lot. So I will do a couple quick little intro videos this week sometime, hopefully maybe next week, and they'll definitely be done by like the end of May, with jade rolling and the proper lymphatic way to jade roll your face, and where the lymph vessels are and how to do that. But a lymphatic facial does that for you and takes care of all of it, and muscles have a big component to do with that. If you're doing it yourself and your face is clenched, or you're looking at yourself while you're doing it and your face isn't totally relaxed, it's not going to work as well, which is why lymphatic facial is a very good thing. Also, congestion. So sinus congestion, runny, watery eyes, things like that, those are all things that it's good for. Acne, swelling, all kinds of stuff like that that we see and we use our lymphatic facials for. So it's definitely something to ask us about. It's definitely something to look into. But with these Botox and these injectables and these PRP and all these things that come out for the face, yes, even though they are not surgery specifically, they still require recovery, which we still specialize in. So if you guys have any questions about this, please feel free to give us a call. Call our office. We'll be able to set up a virtual consult or a phone, thing, so that we can get you scheduled with our scheduling coordinators and in the office to see me. I hope this was helpful. Again, just a short little video on all of that. So I will talk to you guys soon. Thank you so much. Have a great day. Bye.